We are live. Outstanding. Hey, everybody. Dr. Rob here. Excited about our inaugural Ask Dr. Rob. Any question about health, whatever you have an inquiry about, I am happy to share, answer any questions. Got my full team here. We're ready to go. I really appreciate everybody sending some questions in a little early so we could cover some things. As we all know, 2024 is upon us. The topic of conversation is longevity. I did not see any longevity questions yet. So if anybody has a longevity question, I'm happy to answer that as well. Let's really emphasize longevity, overall healthcare, immunity, gut to brain axis, of course, weight loss, intermittent fasting, anything that you really want. So we're giving people some time to pop on. I'm going to open up my comments section over here so I can see it down here. That's great. If you have any comments or anything like that, feel free. Let me know where you're from. I'd love to know where everybody's listening from. We got a whole bunch of people here on the StreamYard. So let me know as I get ready for the first question that somebody sent in yesterday. Anybody say there? No one's on StreamYard telling me where they're from. They're a little shy. And I apologize in advance, guys. I am suffering from laryngitis. So if you hear me cough, it's not contagious. We'll be good. Even the functional medicine practitioners run into some trouble once in a while. Anybody there want to say where they're from?
They just said hi.
Hey, everybody. All right, let's dig in. First question today was, so many people are concerned about cholesterol. There's a lot of confusions about cholesterol. How do you lower cholesterol? I think that's a great question, a great way to start off. First of all, cholesterol is not the problem. High cholesterol is not necessarily the problem. It's the understanding what makes cholesterol. So let's get this clear. Most people believe cholesterol gets elevated because of ingestion of cholesterol. That is not correct. You can only raise your cholesterol markers about 15% from eating cholesterol. Cholesterol levels increase, dangerous cholesterol levels increase because the overconsumption of sugar, the overconsumption of carbohydrates. So if you're worried about your cholesterol level, the first thing you should do is decrease your consumption of sugar, carbohydrates, and of course, fructose. But the big culprit, and please, if you're going to have one takeaway from today, hear this number, 63% of Americans get their calories from ultra-processed food. So today, day one, let's all start decreasing dramatically our ingestion of ultra-processed food. Ultra-processed food, as a definition, would be any man-made food with 5 ingredients or more, typically using hydrogenated oils, fructose, sugars, crappy oils, etc. So more so than that, cholesterol, we've got a whole bunch of things I can see people asking a lot of questions. So cholesterol, is elevation a problem? Well, I mean, to say that high total cholesterol is a problem, I wouldn't do that. But here are the markers, and here are the things that everybody should look for on a cholesterol test. This is what you want to ask your doctor. This is what you want to ask your family practitioner. This is what you want to ask your functional medicine practitioner. You want to ask them these 3 or 4 simple little things. Number one, everybody, you want to ask them to test for their ApoB status. Less than 5% of the population have had their ApoB status. Your ApoB status will tell you all the bad particles that are being carried in your bloodstream. So ApoB is a critical element. Most practitioners to date have not tested for ApoB. ApoB is the most revealing cholesterol marker that you can conceivably have. In addition to ApoB, something else you would test for is Lp little a. Lp little a is your genetic marker. It increases your incidence of heart attack dramatically if it's elevated. And it's, I think 33 or higher is the marker you would do on your blood test. More so than that, Lp little a, watch out. Statins do not help Lp little a. They actually, it's an inconvenient truth, they elevate Lp little a. So you want to test your Lp little a because it's a heart attack marker. If you have it, which 25% of the population does, that means 40% of your relatives have Lp little a. So if you have a family member that has Lp little a, you want to get your LP(a) tested. Now, what would you do to decrease ApoB, LP(a), and the bad cholesterol, LDL? LDL, and the reason I say L is lousy. You want it low. So here's some things that you'd want to do. It's all about lifestyle, without question. Lifestyle, first thing, we said it before, decrease your carbohydrate consumption, decrease carbohydrates, decrease sugar, decrease fructose, decrease your ultra-processed food. Some supplements that I recommend, and this will be simple, little easy, implementable tasks, would be omega-3 fatty acids, niacin, red rice yeast, phytosteroids, vitamin D3, and of course, support your gut, pre and probiotics. So you want to lower your cholesterol, but you really want to lower your LDL. And one little caveat to that is you want an LDL direct test. You do not want an LDL calculated test. So test for LDL, test for LP(a), test for ApoB. Those are 3 great markers to start with. There's some others, but for now, if you get that, you're really making an indelible mark and understanding what you need to do to take your steps forward. We had some other questions.
Justin wants to know if you've seen good results with SPM for MSK pain, and do you generally combine them with other nutraceuticals?
So Justin, that's a great question. Justin asked about SPMs, specialized pro-resolving mediators, how they work for and help with musculoskeletal pain, and do you take them with any in conjunction with other supplements? Great question. So interestingly enough, I have used specialized pro-resolving mediators or pro-resolving mediators for the last 9 years. The studies have come out, and I think it was 2015 from Harvard University. Dr. Charles Sarhan is the gentleman who founded it. And basically, specialized pro-resolving mediators are the next step after omega-3 fatty acids. Omega-3 fatty acids, as we all know, EPA and DHA, they come from fish oils, and the preference there is wild fish. My acronym for the fish that you may want to use is SMASH: salmon, mackerel, anchovy, sardines, and herrings. Coming back to the specialized pro-resolving mediators, omega-3 fatty acids are supposed to be able to convert to pro-resolving mediators and then make the next step to specialized pro-resolving mediators. Unfortunately, we, the humans, are not very good converters at this stage of our evolution, because there's so many needed nutrient coenzymes, and the environment would need to be so rich in health, which it's not. We do not convert. So taking specialized pro-resolving mediators in a supplement form is a great choice. I like to take the SPMs with omega-3 fatty acids, not in place of, in conjunction with them. That is a huge takeaway. Remember, don't replace omega-3s with SPMs, take them with SPMs. So what's the whole point of it? What's the purpose, their function? Pro-resolving mediators or specialized pro-resolving mediators allow for the resolution of inflammation. If I had to do one thing with every patient that walked in this particular office, it would probably decrease their inflammation. SPMs provide that little switch. They allow for the resolution of inflammation. There's an initiation and there's a resolution. There should be a homeostasis between the two. And when there is, you have a perfectly burning fire. If not, fire burns too high, it burns too long. It's very detrimental and or deleterious to other structures and your overall health. So Justin, great question. I always want to decrease inflammation in a musculoskeletal light. I use it as my foundation nutrition in my chiropractic-based practice. Do we have another question?
Robert Jacobs, what would be your go-to therapy modalities or treatments for bulging disc L5 to S1?
Great question. Hey, Bob, how are you? Hope all is well. Long time no see. We've got to get together. We've got to catch up. We got to get you on a podcast. So make note. I appreciate you taking time out of your day to come ask a question. So L5-S1, that is probably one of the 2 most common areas for a disc injury. It's L4, L5, L5-S1, disc herniation. 1/3 of America walks around with a disc herniation without pain. So when you hear the word disc herniation, everyone, do not have the immediate association with disc surgery. Disc surgery does not have really good outcomes, generally speaking. So I would always pause for concern if you hear the word surgery. It is not an immediate surgery if you have a disc herniation. There are a lot, as Dr. Jacobs just asked, a lot of options that you can consider. So number one thing I like to use for disc herniations is an FDA cleared non-thermal low level laser. Everybody knows I'm a laser guy. I'm all about utilizing laser. Laser in a low level, meaning not a power laser, specific wavelengths. The wavelengths that I'm going to mention are 635, which is a red light, 520, which is a green light, and violet light, which is 405. Each one has a specific different property because they're a different spectrum of light with a different wavelength. So they have different functions. That said, I have found laser to revolutionize my approach to lower back pain and disc herniation because it allows for photochemistry. Photons go in the area and you get a chemical reaction. Essentially, it stimulates healing at the level of the cells. It exponentially increases the cells to heal at a faster rate. It's also been shown to have a decrease in inflammation. And when you utilize all three of those wavelengths, you're allowed to stimulate the mitochondria. And believe it or not, what we see now is a lot of issues really based on the fact of mitochondrial dysfunction. So first and foremost, low-level laser therapy. Number two, I like decompression therapy. I found it to be very effective. And I combine the decompression with the decompression traction, flex cox distraction, and laser therapy at the same time. In addition to that, I'm going to use a lot of soft tissue to release the areas and bring down the function, I should say, bring down the friction in the specific lumbar area. In addition, I like a couple of nutrients. Let me give you my lumbar spine protocol. Number one, believe it or not, glucosamine and chondroitin. Studies have shown since 2003 to add glucosamine and chondroitin, 1,500 milligrams of glucosamine, 1,200 milligrams of chondroitin, omega-3 fatty acids, 46 grams, vitamin D3 with K2, 5,000 IUs of vitamin D3. Hyaluronic acid is also a great add. Here's one of the biggest surprises, melatonin. 3 to 5 milligrams of melatonin, a great choice. I am a melatonin fan. Bring it on if you're not. Let's have that discussion. For me, melatonin has shown to be very effective, not only for lumbar spine, but also to decrease the release of LPS in the disc and a pre and probiotic. And lastly, but not least, core rehab. You've got to really reset your core so you don't strain yourself at the spinal discal level. Do you have another question? Okay. So it's funny that I talked about core. I got a question here. Thanks for being live, Dr. Rob, and for taking our questions. As you speak of fish oils and SPM, what are your thoughts on krill oil? What a great question. Thanks, Dr. Work. I appreciate that question. I'm going to say this. I am not a krill oil fan. I'm not a krill oil fan. One, it's much more expensive. Two, I much prefer to see the fish oils come again from the SMASH acronym: salmon, mackerel, anchovy, sardines, and herring. I think the best choice for an omega-3 fatty acid source, and everybody should ask where its source is from, would be salmon oil. Getting back to lower back pain, it's funny. Somebody asked yesterday, why do planks over other core exercises? Or why do I like planks over other core exercises? Well, the studies show, I have a few studies down here, that planks actually lower blood pressure. They strengthen your core and they stabilize your spine. Sit-ups and crunches are actually causing lumbar flexion. You're bending at the lumbar spine, which is actually damaging that already damaged injured disc. So a proper core exercise would be one where you engage the core in a 360-degree light. So you really want to brace, like bearing down, to generate proper core integral activation. Nope. So somebody asked me yesterday, best diet. They hear a lot of information about the blue zones. They hear a lot of information about plant-based, carnivore diet, Mediterranean diet, keto diet. Which is the best diet? Well, any diet that you choose is better than the SAD diet, which is the standard American diet. So great choice on any of those. The diets that come to mind that I like to really discuss, I do like to talk about the blue zones. Incidentally, does anyone know why they call it the blue zone? It's right here. They call it the blue zone because they actually circled it with this color pen, a blue pen. That's right. That's why they call it the blue zone. That said, it's a 95% plant-based diet. So everybody knows what's in vogue now is plant-based, or really more than that, plant-forward diet. So it's 95% plant-based, low amount of protein, moderate to low amount of fish. They have a community base. There's exercise involved. So I love the idea of the lifestyle without question. However, for me, 95% plant-based or plant-forward is a little much. The one tweak I like to the blue zone would be about 80% plant-based, plant-forward, and about 20% protein. So that said, not that the carnivore diet isn't good. I'm not anti-carnivore diet. I like to see a little more plants. I like to see those phytonutrients. I like to see a limitation of fruits, or a lot of fruits at one time. And yes, I am drinking my Java. It's my afternoon cup. Mediterranean diet, been voted, 10 years in a row as the best diet. Great choice. Have no issues. Keto diet, really great. I know we have a question about brain injury, etc. But the ketogenic diet's a great choice for epilepsy, brain injuries. And the reason is that the ketogenic diet is based on fat. It's about 70 to 75% fat, 20% protein, 5% carbohydrates. Carbohydrates are dirty fuel for the brain. Fat is clean fuel. So obviously the ketogenic diet. But here's a takeaway on diets. It's all about you. I'm a big proponent of N of 1. N of 1 means taking all these data points and individualizing and personalizing it for you. So it's best what you need. My team is a different demographic than I am. We're not all going to eat the same. We may have lunch together, but we all have different needs because we can have different ethnic backgrounds. We have different goals, different sexes, different stages of life. So you want to find a practitioner that individualizes and personalizes the diet for you and the stage that you're in. That being said, here's a couple of simple facts. I'll give you 3 things. Eat whole foods. If man makes it, I won't eat it. Jacqueline once said it. Try to eat within a window of a time. So you do want to intermittent fast. You should eat in a window of 8 to 10 hours, and you should fast in a window of 14 to 6 hours. And number 3, exercise. Get 10,000 steps a day. Get your weight resistance. If you had to do one thing a day, get some weight resistance. That doesn't mean get a barbell and throw it over your head with 400 pounds. Weight resistance, you have body weight. Get exercise. So the overriding theme is change your lifestyle. Do we get any more, or should I go to over here? Okay. Hi, Marcelo. Brain injury survivor, 2015. My heart goes out to you. TBI survivor, 5-inch head scar. Wow. The month of March is Brain Injury Awareness Month. Thank you. Yeah, absolutely. It's all about the brain. The gut and the brain communicate. TBI, concussion. Here's a couple of supplements that I would recommend to help with brain healing, neuroplasticity, brain neurogenesis. Number 1, magnesium L-threonate. It's a great choice. 2 grams of magnesium L-threonate has shown to decrease brain aging by 9 to 14 years. The question before, specialized pro-resolving mediators have shown to decrease inflammation in the brain. A great choice. Omega-3 fatty acids. Omega-3 fatty acids are the number 1 supplement to respond and repair from concussions. In addition, I love L-glutathione. L-glutathione has shown to decrease brain trauma injury by 70%. Here's the secret sauce, maybe a hidden gem, if you will, choline. Choline actually switches the microglials from an M1 to an M2. What did I just say? An M1 microglial is a pro-inflammatory microglial. They're actually your macrophages in your central nervous system, and they chew up too much structure or too much debris, and they start attacking you. When you're in an M2 microglial phase, you are in an anti-inflammatory microglial phase. So therefore, choline ensures the fact that you're going to be anti-inflammatory in your brain. Women have a tendency to have more microglial issues than men. And my 5th choice would be, believe it or not, even though it is your brain, I'm a big proponent of taking a pre and probiotic for your brain, because whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Happy brain, happy gut, happy life. Anybody alive over there? Okay, you'll let me know. Somebody asked yesterday a question, a great question. How would you extend health span? So it's sort of a longevity question, and that begs the question of what is longevity? Can we have a definition of it? Well, it's lifespan versus health span. We obviously want to increase lifespan, but we want to dramatically increase health span so the two of them match at the same time. So everybody's most concerned about health span. My little caveat to health span is real simple. I love health span, but I also love vitality. So some of the things that I would recommend for that would definitely be decreasing consumption of ultra-processed foods. We talked about that before. I would eat phytonutrients. I would eat nutrient-rich foods. I would eat the right kind of protein. A lot of people ask me, what's the right kind of protein? Well, everybody knows I like 80% plant-based and 20% protein. I like animal-based protein. They really help with muscle protein synthesis. They also increase the ability to put muscle mass down. Muscle mass is your longevity organ. They also allow for a great muscle to fat ratio. I think the step ladder to health is muscle mass as a starting point. Muscle to fat ratio is number 2. And power, good animal protein, good choices of protein are going to enable you to have that. You want to eat the right kinds of fat, which are poly and monounsaturated fats. You want to limit your saturated fats. You always want to optimize your diet. The first thing I ever heard when I decided to go in nutrition was a Hippocrates statement, which said, let food be your medicine. Let medicine be your food. You want daily exercise. And of course, to pertaining, you always want brain health. So those omega-3s, pro-resolving mediators, and the like are really, really great choices. I had another question that they asked yesterday. They said, what's new on the horizon? Well, I don't know if this is new, but there was a study that just came out last night in the Annals of Internal Medicine, and I have it right here. It was over 36,000 participants with postmenopausal women, and they found out that there'd be a dramatic decrease in colorectal cancer and breast cancer if you took these 2 supplements, vitamin D3 and calcium. So all those women who are postmenopausal that want to get a precipitous drop in breast cancer, 19%, and colorectal cancer, 31%, take vitamin D3 with K2 and calcium. That came out to be the winning combination yesterday. Let me see if I have any other questions here.
John wanted to know about collagen.
Yes. A good patient of mine, John Condon, wanted to know about collagen. Does it work? What kinds, etc.? Well, I'm a big collagen proponent. Collagen has shown, he initially inquired about collagen for tightening of the skin. And that's what collagen does. It enables you to tighten the skin. It's also the most abundant protein. It's about 30% of proteins in the body. If you're looking at collagen to help your gut, you're looking at collagen, not just your gut, but your musculoskeletal system, tendons, ligaments, cartilage, and the like. You're looking at collagen 1, 2, and 3. If you're looking at taking collagen to help your eyes, you're looking at collagen 5. And if you're looking at collagen to help your bones, you're looking at collagen number 10. I had a question yesterday that they asked about fascia. So I have some information here on fascia. You guys will love this. Fascia is the saran wrap of your body. When you pull away, if I could metaphorically, the skin of a chicken, you would see the skin, you would see the chicken breast, and there'd be a white film between the skin and the chicken breast. That would be fascia. Fascia is your living matrix. It's your full body wetsuit. It's connective tissue. It sheaths in the body. As I said before, it's below the skin and above the muscle. Lymph nodes, nerves, all live in fascia. Fascia is a sensory organ. It is the only organ, because it connects with the skin, that communicates with the whole body. And fascia accounts for 20% of your body mass. So take good care of your fascia. No, we've got a quiet day today. I'm having a great time, though. Oh, got another one. Hey, they're popping in from Colorado. What part of, is it Boulder, Colorado? Is it Denver, Colorado? What do we have there?
You also had people from Sweden.
People from Sweden. Hello, everybody. Did anybody else say where they were from? We didn't get anybody from Malaysia today? Well, we'll be doing this every week, Eastern time at 2:00 p.m. If you have any questions, feel free to send them in. This is our inaugural Ask Dr. Rob. We're going to grow this platform. I'm excited to share insights. I am here for you. Just remember, my name is Dr. Rob Silverman. Always yours in health.